Okay. I want to welcome everyone to the 2026 budget hearings for Health and Human Services. We're going to start, we'll be here all day. I want to thank Jamie for the donuts. Okay, we have a department overview here from 9 o'clock to 9:05. Jennifer, take it away.
Okay, I sent this overview out to everybody on Friday, kind of thinking that it might do people a little bit of good to sort of review it a little bit, get an idea of how this intro works. So you guys probably don't need me to read through it because I'm sure you read your email on Friday, Bob. I'm sure you did. But I'm still just going to walk through it really, really quickly. Walking through inside the budget binders, the first section with the bigger tabs is the actual tentative budget. You have your operating budget section, which includes the local share summary and shows all activity for all funds, displays the tax levy, your property valuation, and tax rate for 2026, 2025, and the changes year over year. You have your capital budget. Section includes the status of active capital projects and a list of proposed projects for additional funding or new funding in 2026. Personal services analysis is everybody's favorite. It's the FTEs. It shows the change in position count for year over year from 25 to the proposed 26 budget. And you have your fiscal status section, which includes your fund balance and debt schedules. This demonstrates the use of fund balance and reserves, and these uses are not reflected at the department level. They're only broken out in detail on that local share spreadsheet. So if you're looking for greater detail for those things, that's where you'd want to look. Your budget summaries and your line item detail are the sections with the smaller tabs behind the tentative budget. Your budget summary components consist of your FTE or position summary. There's your local share summary for each department by department. We have your summary by department at classification level with comments, and these budget hearings primarily focus on those. Your summary by organization at the classification level summarizes the individual departments that follow. And then your budget worksheet report, which is the line item detail report that you see behind each summary. In the front cover of your binders, you have your financial projections for 2026 to 2030. And then overall highlights, the FTE count in governmental funds increased 26.17%, the bulk of which are broken out between a handful of departments. I did list that in the overview. I don't plan to necessarily walk through that. We can touch on those things during the course of reviews if you didn't get a chance to read it. Base pay includes percentage increases for both managers and the applicable increases for the collective bargaining agreements. And again, this year, we did plug in a 5% vacancy savings. So that's something else that you're going to want to keep in mind while you're looking through these proposed budgets. As in past years, and we have noted this before, that this is not necessarily an expectation that the departments attempt not to fill their positions. We're not telling people, oh, no, don't fill your positions. This is just an estimate of where we think our savings will end up during the course of the year because we're currently still trending right around 8%. And just a very quick note, all 0.8 accounts are a derivative of the 0.1s. So you really cannot adjust any of your 0.8s without doing something to your 0.1s, being staffing. Recommended format for the budget reviews. Department heads will lead the committee through their budget summaries. The deputy director, or in some cases fiscal supervisor, will assist the department heads with detailed answers depending on what questions are asked and what's needed. You can refer to your budget by account detail as necessary. And it is recommended that the committee vote on any desired amendments to send to audit and control either during the course of the meeting for each department or at the end of the day summarizing all departments. So you guys can do it however you see fit, but we definitely suggest that you make it a point to do that before the end of the day if you have any recommended changes. And it is further recommended that to the extent possible, if you can, committee, propose amendments to offset any increases to appropriations or decreases in revenues. Okay? And then for this particular committee, we have a little bit more of an overview of things that we wanted to touch on with all of you. Okay? We wanted to make you aware of some risks, particularly pertaining to the Human Services Departments for the 2026 budget. Final adjustments to the tentative budget for vacancy savings and the health insurance surcharge resulted in reductions to countywide appropriations. Due to some time constraints that we ran into when we changed it, because it was originally plugged in at a 3% estimate, we then, at the last minute, ended up increasing it to a 5% because of how high we're still trending. Revenue to some corresponding appropriations was not adjusted for these changes in all cases. So there are some health service revenues that may appear to be overstated. The approach to move forward without adjusting revenue, while not ideal, was deemed reasonable because the net local share was the intended outcome. Alternatively, had time permitted, other expenses would have been reduced to come to the same resulting local share. The decision was also based on the knowledge that sufficient fund balance exists that could be used to offset budgetary shortfalls, and cost-cutting measures could be enacted during the fiscal year should that end up being necessary. Safety net costs do continue to increase. There are many unquantifiable factors limiting our ability to project the costs in the future. So rather than increase taxes when expenditures are difficult to project, the budget for safety net is conservative in that it is not budgeted at a worst-case scenario. The potential does exist for costs to exceed the proposed amount, and historical trends do indicate that these expenses can both rise and fall. Considering the upward trend may taper off in the future, fund balance was used to offset half of the local share increase in safety net in the 2026 budget. So we just wanted to make sure that you were aware of that as well. And these above strategies allowed us to stay within the tax cap and use fund balance where practical and only as needed. It is understood that close monitoring will be essential throughout 2026 at the department level and for us as well. So I'm finished. That's it. Thank you.
First up on the agenda is the Mental Health and Social Services Department. I guess before we start, do we have any questions on the overview from anyone?
Yes, sir.
Mr. Johnson?
Do I have to speak into the mic? I will. So I'm just looking at the long-term trends. And I see, the big driver is compensation, and we're accepting and projecting 4.5% increases year after year. That's roughly twice the rate of inflation. I mean, taken to infinity, that will absorb everything. Why do we project, manage with that kind of big driver when inflation is, the Fed's target is 2%, but we're running 2.5%? Why are we projecting to have our biggest cost driver go faster than inflation year after year when our population isn't increasing?
So if you're referring to the insert that are the 5-year projections, we
Yes, ma'am.
we will go through those in detail during Administrative Services Committee. But those particular, those are assumptions in a model that is a projection. So the assumptions used in the 5-year plan they're just that, the assumptions that were used. We could base it on other factors to see what the result is. But that's why I have the page that gives you all of the assumptions that were used, and then that shows you what the net result is if those are indeed the outcomes.
I appreciate the math and I appreciate the transparency. I would be much more comfortable if we started from the beginning thinking in terms of doing better than inflation rather than worse.
So the other part of the specific reference to the 4.5%, that is for personnel costs.
Sure, which are a big driver.
Correct. And they also are based on a projection associated with our collective bargaining agreements.
But that's supposed to be under our control as well.
Well, we have
Long-term.
the CSEA contract and the CCSEA contracts, CSEA being our biggest bargaining unit, the main workforce. Their current contract goes until 2027. And then, as you know, the sheriff's contracts that were just approved, those now go across the next 4 years.
I'm sure, I don't need to make an argument on that, of course. I appreciate all the hard work. As to the bargaining agreements, of course, we're talking dollars here. And typically, when one pays more than inflation for something, one expects physical productivity as a result. And so I would think that those increases in per capita compensation costs would be partially offset or wholly offset by increased productivity. But again, that's I don't want to leave it at that.
And just as a reminder, too, some of those personnel costs are reimbursed, so that's not the net impact. But we'll go through the projections in more detail tomorrow.
Thank you.
Thank you. Okay, if you all could introduce yourself.
Carmelo Hernandez, Commissioner of Mental Hygiene and Social Services.
Morning, John Anderson, Deputy Commissioner of Social Services.
Good morning, Blake Urick, Director of Administrative Services.
And Trish McLennan, Deputy Director, Mental Hygiene and Social Services.
Kimberly Latone, Fiscal Supervisor for Mental Hygiene.
Okay.
So one of the things that the team up here, we discussed is a lot of the time we dive into the weeds and go into the numbers and speak to the numbers. And the one part that we've missed out on, which is an opportunity to have great dialogue and great conversation as to how these dollars are spent and also the impact that it has within the county and community, like social services itself with domestic violence centers, homeless shelters, and child welfare programming as well. So these dollars are not just for programs that we're running, but also that we have within the community. In reference to mental hygiene and the LGU, Trish could most definitely talk to that, but we have approximately 12 organizations that we assist and help within our county to help provide some services as well. And Trish will tell you a little bit more detail.
So for mental hygiene, one of the things I think we often neglect is that we do talk a lot about, we'd like more money, we'd like approval for a resolution, we'd like to provide a new service. I hear a lot about we're going to keep increasing our footprint. And what I want to make sure we're also talking about is a responsibility in New York State that each county has. Each county has to have a local governmental unit, and it's appointed to the county director of community services. So in this case, your local governmental unit is Chautauqua County Department of Mental Hygiene. What that requires we do by Mental Hygiene Law 41.0 is that we are required to plan all services in our county that impact mental health and substance use disorders. And we also have to be involved in the Department of Developmental Disabilities. So what does that mean? That means that we have a requirement and a responsibility to not only plan for, but we also receive, and you'll see it in this budget, which is why I want to make sure we're talking about this. You'll see we have quite a bit of state aid. There's about 36 to 40 categories that we have to ensure are covered with that state aid, and that we partner and bridge with the right organizations. So part of what we do is that we not only plan with our partners, but we also have a responsibility to make sure the outcomes are there. So your statement, Mr. Johnson, about where's the productivity, where's the outcomes, that is something you should be asking for. Part of what state aid can do, if you look at our one hospital we have in this county that provides behavioral health services, is UPMC Chautauqua. If you happened to be unfortunate enough to be in their emergency department this weekend, you would have seen 12 people, I got a call about this, 12 patients in the emergency department at one time requiring a behavioral health evaluation. What does that mean? It means that others who are there, maybe you had cardiac issues, maybe a family was in a car accident, that all has to get filtered into their 28-bed ED. So where does this fit in with us? We have a responsibility to ensure that we're planning for the future. You're going to hear us, and I don't want to go into our budget first, but you're going to hear us talking about a crisis stabilization center and where the funding comes from that, where our responsibility is. Are we going to reduce and be able to have an impact on reducing wait times in EDs so that others are getting the needs met? Are we going to be able to have an impact on homelessness and shelters? Not only social services, but mental hygiene does as well. So that bridging, the partnership, and then when other organizations are either not able, don't have the bandwidth, or don't have the appetite to provide some of these services that are essential, then we pick up. And that's where sometimes you see a footprint. That's where you sometimes see me asking, like I did recently, about an okay to be more in the schools, because it's not able to be met by other organizations. We meet regularly to say, hey, anyone else interested? Hey, can we help support this? Is there funding for this? So that's what I want to make sure we're doing too, is that you're recognizing the LGU is required by law to do the planning, not just provision of services. If we don't plan it, we're in violation of New York State Mental Hygiene Law 41.0. So just quick summary to kind of match it. Ask where it fits if you need to. Ask if it's us or someone else. Ask why it's us if you need to. We're glad to help with that. Okay. Thank you.
So with that being said, we're going to start with the social services side of the house. And we have some changes in our position summary. And these changes are due to minor allocation changes between mental hygiene and social service areas. That's myself and my assistant, Beth Lord. The director of certification recently retired, so they were removed from the Youth Bureau administration. And as Trish was stating, we do have 4 new positions that are 100% state funded for the Family Center Case Management team, which are here to help with homelessness. Just as of recently, as of Friday morning, we got permission from the Office of Temporary Disability Assistance that this team can not only work with families, we have been given permission that they could work with everybody, individuals and families. So that was a huge lift for us.
For the homeless.
Yes.
And one thing I'd like to note, the copy on the your copy, the FTE summary here, for the A6010 social service admin, the one line that says plus 1 position not budgeted in 2025, that during the cost-cutting stages, we cut that position from the budget. So that is not applicable to this budget. So there's really only 4 new FTEs for social services, and they're fully funded.
All right, so when we're looking here at 6010, we got a decrease due to equipment and software upgrades that were budgeted in 2025 that are not budgeted in 2026. The 2026 increase in existing contract costs projection was 361 in contracts that was not included in 2025 due to an error. An increase due to rising to the 4 fully funded individuals for the Family Center Case Management.
Any questions on 6010?
Can you just explain the 4 new positions there a little bit? You said the Family Center?
Family Center Case Management, yes. So we have 2 caseworkers and 2 senior caseworkers. So the 2 senior caseworkers, if you probably heard us speak in the past about care coordination, that's where they're coming from the mental hygiene side, but they're now on the social services side. And the 2 case managers are social service case managers. So they do everything from your application, helping budget, and helping you find housing. And also putting referrals in as well. Referrals to either mental health, which the senior case managers could do also, or substance use, and or just finding resources within the community.
That's funded with about $495,000 state funds from New York State Office of Temporary and Disability Assistance for the purposes that Carmela just mentioned. So we go through an annual approval process for the plan. Carmela works with a team to put together a plan to address some of the issues that at first families were facing with homelessness, but now moving into, as Carmela said, into adults as well. I think Trish said it actually. So yeah, so that's a big deal. It's $495,000 directly from the state for this purpose.
Do you think this will help get some people into the housing that's needed, and is there the housing available? I know we've been, actively trying to promote housing in new places to live, which will also help reduce some of our safety net costs there, is the hope as well. So, we haven't gotten to that portion yet, but this is where it directly affects it.
Most definitely. So they have helped already and prevent some evictions, which is great news, more than some, so I'm being kind of nice saying some. And I actually have a meeting this afternoon at approximately 2:30 p.m. with the Office of Temporary Disability Assistance to speak specifically about this program and how can we expand it. I'm not necessarily going to ask them for more money. I'm really just going to promote and produce the outcomes that we already have and the importance of how we could expand it due to the high need, as you mentioned, in finding housing, finding partners, also emergency shelters, and also the low barrier wellness center that we're working on with Recovery Options Made Easy, because it's so multifaceted, which I'm more than willing to speak to anyone about it, how complex it is. But the reality is this is one component to try to help mitigate and most definitely bring down safety net, but most also provide those quality services to the individuals that deserve them.
I'm sorry, go ahead.
Is this adequate too? Is this enough? I realize you're using the funds that are directed from fully funded state positions, right? But, what is the county doing to help this situation too? And instead of lopping more onto the safety net side, it'd be nice to put more into an area that actually would affect the safety net area too, for more longevity.
I will say, and Carmela, you of course say what you think as well, but you mentioned housing. I think that some of the things that I heard this last week in legislative meetings about the housing, push for more housing, I think that is necessary, and that will be helpful. The case management team that Carmela has worked to integrate that with some of our other social services teams and behavioral health staff and peer support. So there's been a lot of work to integrate the staff that might have been working on the issue separate to be more forceful in how we assist. There's those aspects. I think the housing is very helpful. We received approval from the state for the PASS program, which helps with the amount of shelter supplements available for people to enter out of temporary shelter into housing, and we do see that there is a need for more housing.
I agree.
We can help more people get into housing if that were addressed. I think it's in the process.
Yeah, and I think the other piece, just that mental hygiene will be, and that's part of this collaboration piece of integration, importance of integration, mental hygiene and social services, is Carmela and I are meeting with an organization that's already established in providing step-down and housing. So in other words, some long-term, meaning it can go up to 2 years of housing for those in early recovery. What that does is helps prevent a quick, keep people longer in hospitals, get them out of the hospitals, get them out of the treatment, get them into the community, learn how to work effectively in the community, literally work too, because part of this is to have a job and to be able to function in that level. But we'll be meeting with them
This week.
this week. There you go. You've got better memory of your calendar than I do, just to see if there are some opportunities within our county, either South County or North County, to build some more of these residences. And that helps with the step down too, and helps with the in and out.
It's exactly the kind of thing that's needed.
Yeah.
Any other questions?
Mr. Chairman, I'm going to apologize for the only time today for getting into the details, because I love the details, but if I can take you into the details section of your budget, I note that you are reflecting no revenue for the HEAP program in 2026. Could you please elaborate on that?
I think you guys probably already know more about the heat plans.
Well, right now, we're not exactly sure what's going to happen with HEAP, but at the federal level, there were changes, meaning that the HEAP program, the funding at the federal level is going away. So they're anticipating in the budget process, I believe, Blake, is what you did, that we would not receive funding. However, I would say about a month ago, there was a call with OTDA about the HEAP program in New York State, and New York State has since submitted a plan to the federal government for a HEAP program that would be somewhat smaller, not in what it does, but some of the extra benefits that have existed in the past. That's been submitted. The state is waiting for approval from the federal government. I will say that in the call, OTDA announced that there were other states that have submitted their plans despite the cut at the federal level, and they have been approved. So we don't know what's going to happen next. We're waiting. I don't know what's going to happen next with that. We're anticipating there will be heat. We don't know exactly what part will be approved. Hopefully all of what the state submitted, and that would mean a change here. So that's why that was done that way.
Thank you. I anticipated that answer.
Yeah.
So this is a potential improvement in the revenue.
Correct. Because I think there's about $500,000 that's heat admin dollars.
Yes, $500,000.
Yeah, so that was removed, and if this is reinstated, then hopefully we would see that reinstated as well.
Okay.
Be a positive change.
Thank you, John.
Yeah.
Next question. Overtime pay increased by 75% in social services admin.
Is that an increase next year?
Yeah.
I'll let you talk to that.
Well, as you can see, we were trending, so this is the 2025 actual amount, about $70,000. We were trending about $140,000 into by the end of year, this year. So with current trends, that's kind of what we budgeted for, but.
I think there's an opportunity here as well for some potential savings on overtime. It may be that there could be a change in that.
Yeah.
I would say that.
Yep.
Okay, so again, there could be an opportunity.
Correct.
For cost reduction.
Yes.
Looking at legal services, I see that there's $90,000 that's budgeted for legal services that was not in this year's budget.
So we actually broke that out for, let's see, within, if you see here in the line above in 4,500 accounting and related services, that amount was actually budgeted in last year within that, so we actually broke the two out this year. So that 90,000 essentially was just budgeted in accounting and related services. We wanted to break that out because we wanted to keep that separate.
Good answer. Thank you. Looking at social services roles, it's an 85% increase. I've got to confess, I don't even know what that is, but could you elaborate on that?
I'm not sure.
That's the claiming. It's the contracts, RSP allocations. It's pretty much other contractuals. The same thing as that.
So what's it?
DSS contracts.
Okay.
So it just an increase in contracts, contractuals.
Normal expected increases in contracts.
Yeah, that, and then we also, on the summary page, we noted there was about $360,000 that was not budgeted in 2025 that should have been. So that's also an additional increase.
Okay. And please help me understand the contracts.
What we're contracting for?
Yes.
Well, it can be all kinds of services. It can be legal services, it can be software services, it can be contracts with other agencies, provide services like Trish talked about, the mental hygiene has. We have many contracts with agencies.
Salvation Army.
Salvation Army. We contract with JCC for staff development. And all of these contracts come with some degree of revenue. Some of them might come with 100% revenue. Some might come just at our typical administrative rate, around 63-ish%. So we do have a variety of contracts. As Blake said, I think Carmelo might have mentioned, there were some that were left off last year. We did a deeper dive this year into our contracts list so we can make sure everything was included, so you'll see some changes there. And there are some new things, but shelter arrears program, for example, is with COI. That's $86,739. It's 100% state funded. So some of these things you're going to see that there is no real expense locally. It's just all money coming in. And the rest of it will have revenue.
Okay.
Yeah.
Thank you, John.
Yeah.
That's all that I had.
Oh, the one piece that I will mention for the heat that is a concern across the state, and I met with emergency services when I was at NISAC, is the clean and tune, it not being more being able to pay for it anymore with the new heat. So our concern is that possible more emergencies in terms of like fires and things like that in your colder counties. It's been brought up across the state. The governor herself has not said yet if we're going to keep it and if we're going to fund it. So I think we're waiting to see what happens with the plan before she makes that decision. So we should know about that more sooner rather than later, I'll say.
What is sooner rather than later?
I'll say this week, because the fiscal year starts October 1 for them, depending on what happens there. So decisions have to be made between the commissioners and OTDA. It has to be made this week.
And, and then can you alert the body as soon as you know that? It
Yes.
sounds like it could be something that we may be able to change by Friday, is in addition of whatever that revenue we can see in.
If we hear this week, we will definitely notify you.
Absolutely.
If any change, and we can notify you either way by the end of the week.
And also, if you're notifying us, let us know what you think you might be able to decrease out of the overtime account.
Okay.
A suggestion there would be helpful, so.
All right. You and I can talk.
Yep.
Mr. Chairman, I had a question for clarification on heat. So as far as the expense side of it, is that included in the budget now, or you did not include the expense or the revenue for heat?
No, we did not include the expense to heat or within the budget for heat. However, it is one of those where there might be a trickle-down effect. of it.
Truly.
So.
So the way that the trickle-down effect might impact us locally is that so with some of the changes that the state plan makes with the way HEAP is administered, some things that were provided under 100% federal HEAP funding will not be. And they will end up being things that are hitting family assistance and safety net. So if there are emergencies that happen and OTDA is only covering through their HEAP plan one emergency versus two, and the state tells us you're going to cover two, that, for example, might be something that ends up being a safety net or a family assistance case under general social services assistance. So that's where you might see a change, okay? So they're going to continue to do certain things in this plan that they've done in the past, eliminate a few things that they have done in the past, and some of the things they're going to continue to do, the federal government, the federal funds, they're not asking for those at the state level. So you might see a change there.
So just.
And I don't know what that will look like. I honestly couldn't tell you. We just heard this very recently.
So if the revenue does get added back, you would also be adding back an expense
Yes.
as
Yes.
well?
Yes.
So it would
Yes,
not
absolutely.
change the net
No.
total right now?
So, excellent question, Kitty, thank you. Looking at the detail, we're seeing a $500,000 reduction in revenue. Shouldn't we see a $500,000 reduction in expenses somewhere?
Well, the expenses in the admin revenue, they would be paying offsetting salaries and fringe benefits and things like that because it's administrative dollars. So what you're going to see is a less than 100% hit on the budget because you're going to have still reimbursement at the administrative level, is the way that I would see that. So you're still going to see on that $500,000, you're going to see a 63-ish% reimbursement from New York State and federal on admin. We would get a general administrative reimbursement. If that makes sense to you, yes.
I don't understand.
I don't either.
Okay, so we're going to continue to have employees that are there working, administering the program. If we do not see a $500,000 revenue or $500,000 in administrative funding through the HEAP program and from the federal government, we would still be getting administrative reimbursement generally in 60-10, the way that we get all other administrative reimbursement. So it's the same rate as we might for contracts or for other personnel services, things like that. Does that help?
Well, what it sounds like, Legislator Johnson, I'm actually asking your question. It sounds like we're not anticipating the revenue, but we're going to keep the people. We're going to keep the people because we get some other funding to 63% of this cost.
We will still have administrative programs to oversee that are OTDA programs.
Yeah, so the best way I'm like you guys, I like to keep it as common as possible. The best way, to my understanding, the way it works is these employees that are working 100% under heat, we were able to claim them at 100% because it was 100% funded. We're still going to have to provide the service. I'm almost positive about that. So now instead of being able to claim 100%, now would it be that 63%?
So if we get the revenue, we're not going to add back any expenses because the expenses are already there.
There'd be additional expenses?
Do we not
There may be
usually hire
additional.
seasonal staff for heat?
At this point, no, they're year-round staff. I think we made those changes a while back, yeah.
All right,
Maybe 2 or 3 years ago, maybe 3 years ago.
So net, if the feds cut 500,000, we still get 63% from somewhere else, so we're
From the
going to
state.
be, whatever that makes, 37% is going
That's
to come
correct.
right to our bottom line at the county
Yes.
level.
And I guess it's also to clarify that more, are you still anticipating the 63% either way? So the 500,000 is just a, so you're
That's
still
correct.
experiencing 63% now.
correct.
You only eliminated what you expect not to receive.
I do.
So,
That's the truth. And at the same time, yes, we do, Carmelo stating that we do anticipate we're going to be responsible for something here as far as administrating a program that relates to heat.
So 100%.
It's hard to say, so, when you think of it that way.
And we might not see the expense in 6010 without the heat funding, but we would possibly see it more than likely within family assistance and safety net.
Yes.
Yes.
So there would be additional expense.
We still have to provide emergency assistance for heating issues that come up throughout the year. That's part of the mandate for that program. So HEAP is just providing a federal dollar, which would not exist.
So said another way, we just got our revenue cut by $500,000. We're not affirmatively taking any expense reductions on our own to cover that. We're just going to wear it.
Yeah, that sounds better.
And what I can do this afternoon, even though I'll be speaking with OTA about family-centered case management, I can throw in there, hey, can I get an update on what's going on with HEAP and where are we standing at, and pick their brain to see what they're willing to state. Because I know their plan has not been, it hasn't been denied, but it hasn't been approved. So I'll say no news is good news at this point.
We're kind of hanging on that.
And I would like to also point out, this, social services, there are a lot of unquantifiable factors to budget, within this budget, and to forecast out. And as Jen alluded to in her opening statements, with the vacancy savings that came in on the last minute, and our revenue did not get adjusted. So I believe that if he is officially reinstated within the 2026 budget, I feel that there's already enough revenue that's kind of, the balance in itself is already included with the $500,000. So I feel that, it might be a little, because of vacancy savings and the revenue did not get adjusted to it, it's a little overstated.
All right. Anything more on that? Okay.
So next we have our daycare. So expenses here are trending higher due to expanded eligibility. So household income limits have increased substantially. So from our 2025 to 2026 budget, the increase is shown as $600,000 to $7,030. The child care block grant allocation is flat year to year and has been increased in prior years as eligibility has expanded. And John, correct me if I'm wrong, I believe a family of 4 could make an excess of over $100,000 and qualify for child care.
That's correct.
And that 100,000 figure comes down from Albany?
Yes.
Yes.
See, here's I'm sorry, this is my problem with this whole process, is, we're going to peck at this item by item, and I'm certainly not qualified to peck at those item by item. But just a little background, refreshing my memory. New York State has the highest tax burden in the country. When you compare it to Pennsylvania, right next door, at least down in my district, that's who we got to compete with when the jobs go from Welch's Westfield to Welch's Northeast, okay? So total tax burden as a percent of personal income in Pennsylvania is 8.6%. In New York, it's 13.6%. We're 58% higher. Property taxes in Pennsylvania, 2.6% of personal income. New York, 4.3, we're 65% higher. Sales tax, we're 10% higher. This is the draw that we in the county, we at the state level, are taking from our private sector taxpayers in comparison to next door. Do we have better educational results? No, we do not. Do we have better poverty results? No, we do not. We both have big downstate cities. We both have upstate industrial centers. But that's who we're competing with right next door for jobs and prosperity. Now, here we are pecking away at little things, and God bless us. But the background is not pretty. Further, the federal deficit is running 7% of GDP. Absolutely unsustainable. The legislators in Washington have no will to fix that. The bond market is going to fix it. And what you've seen in this latest bill, and what they're arguing about today at the White House, is we're starting to shove those expenditures down to the states, because the states can't borrow money. So this thing is going to, these cuts from the feds are going to get worse because the bond market's going to force it. And here we are in New York State being the worst in terms of how much we take out of the private sector of all 50 states. So hence my concern.
Okay. Do we have anything on daycare 6055? Any questions, concerns, any detail?
Next, we have our services for recipients. You're going to see an increase due in our Title 20 cases. It's a change in the way that we're claiming the cases, and also transferring from FFS allocations to services.
Can you explain that a little more?
I was going to say,
Title 20 is our federal dollars, and Title 20 covers certain child welfare services, domestic violence services, for example, non-residential, residential domestic violence services. So there have been some programs, contracts with agencies in the past, child welfare related, that were in our A6010 program. That's where they would wind up in the budget. A shift was made a couple of years ago, about a year and a half ago, moving those over to a different mechanism for claiming dollars. It's case claiming. So we claim based on that case. So it shows up over here. It runs through services for recipients because it's Title 20 eligible. So we like to spend our Title 20 dollars because they're fully federal dollars first, and then it goes into other general child welfare reimbursement in the end, and something that's called the child welfare settlement. So these services are reimbursed differently after Title 20 dollars are expended.
Okay, well said. And during this time last year, when we did the 2025 budget, we were still learning how the new way they were claiming things online was going to affect it, and we're just transferring more of the Title 20 dollars into services for recipients.
and also the good thing about claiming it through Title 20, which what we call is online claiming, it helps us in the long term if the feds ever want to come in and conduct an audit, and they can actually track the case, know what it was paid for, and all the documentation that goes along with it. So it protects the county.
Any questions on services for recipients?
All right, we have our family assistance. Family assistance costs are increasing after several years. However, case numbers slightly decrease year on year in the hopes of leveling out. The main driver is emergency housing here. So with family assistance costs increasing as we stated, attributed to our foster care and family cases, expenses, so we're placing bigger families. So more sibling groups are being placed together. So the overall case count has also increased, ranging from 1,309 in 2012, a low of 680 in 2022, we all know, post-pandemic, 764 in 2024, and 787 as of July 2025.
So, I'm just looking here that there's, maybe I'm getting this wrong, the revenue is projected downward why? Just in the summary?
The revenue is projected down?
Yeah, by 347.
Wait, which one?
It's percent revenue on family services. Family
Family
assistance.
25, I've seen an increase. Or saying for 2026 budget?
Yeah,
So this projection was ran in July, so I guess I don't have the most updated numbers for that per se, but I can definitely get you more, kind of more updated projections if you need. You know, this budget is based off a conservative scenario. It's not a worst-case scenario by any means. So I can see where we're currently at for this projection as of the end of September, and get back to you on that.
Projection for, when you say projection for 25?
Correct, yeah.
So again, I apologize for taking the 100,000 from you. But perhaps years coming, I would love to see not only our go-forward projections, but our past 5-year actual history. That's one of the troubles of kicking off projections, is that they're not, you know.
And I will say the budget, so this might be an answer to your question, for the budget, that's how we do budget. So we do look at the 5-year trends and kind of see where we're at. So that's why you might not see the projection might be different than what we're actually budgeting, just because of we've seen the historical data based on that, whereas you wouldn't see that in the 2025 projection.
Sure. And so, well, just for next year,
Yep.
you've got a nice 5-year go-forward history. It'd be great to have a 5-year go-back actual history.
are the 5-year trends skewed because of COVID though?
Yes.
Yeah, we would take that into consideration,
Big time.
absolutely. Yep.
Definitely.
Significantly, yes.
Have to be, yeah.
We take that into consideration, absolutely.
Just the numbers that you cited.
Yes, and this is a little jumping ahead, but you're right. And John, correct me if I'm wrong, back in 2012, safety net was actually down and triple FS was actually higher, and now it is flip-flopped. Numbers are very identical, but it's flip-flopped. And we believe a lot of it is due to housing costs, so cost of living post-COVID, but also the pandemic itself and all the things that were allowed during it and post after it is still trying to recover.
Yeah, for example, in 2010, there were more family assistance cases than safety net cases, and the expenses for family assistance were higher. Of course, family assistance is reimbursed at a much higher rate than safety net, so any increase you see above and beyond in safety net is a much larger local share hit because of the low reimbursement rate. So Carmelo is correct. And yeah, we have definitely seen, looking at from 2010 on, a lot of ups and downs in these, but at this point, we do have a larger share, obviously, of safety net than family assistance cases.
My question is, you have stated in here the emergency housing is the main cost driver. You have a leaky roof, it's better to fix the leaky roof than to let it continue to leak and then fix the bathroom ceiling that is now getting affected by it, and then fix the leaky roof. You know, so it's, how do we save cost instead of trying to pick apart a formula to say, well, I think we could probably guess a little better on some revenue sides. The real cost saving is fix the temporary housing costs, and how do we, how are we actively doing that and trying to promote that? And,
Yes.
Also with something we've been discussing for a few years, when are we going to be able to actually see those results too? What do you envision for that for some
Well,
longevity?
for example, with the PASS program, there are some projections already of some savings in not only avoidance of homelessness, but also of people able to exit emergency housing into permanent housing. And as we said earlier, it'd be, more housing would be helpful to that end. But as we talked about heat here, when somebody has a heating emergency, for example, or their furnace is on the fritz, not working, it's those kinds of funds and things that we can do through temporary assistance, through family assistance program and safety net, that help keep people in their homes and make a repair on a furnace or make a repair to the home. So there are those measures as well. There's also dollars available that we use and that are also granted to COI and other agencies in the community to prevent eviction when you have things like arrears and rent. So we do all of those things as well to the extent that we're allowed to by state and federal law. But there are definitely those things in place, not to the extent that is needed, though, to your point.
Absolutely, and one of the things that I can mention, so as Chautauqua County was a standalone homeless coalition. As of recent, I've been working with COI, I actually sit on the board. We have moved more to the balance of state, which what that means is that we're working as a collective, especially for us in Western New York, to be able to get those developers, to get more dollars from HUD and from the state level to be able to create those projects where we can create more housing. Because I think you're absolutely right. I'm not going to disagree with you in the sense of trying to pull from here to put here, robbing Peter to pay Paul, quite honestly, and with the cost that's going up in emergency housing. So yes, shelters would be good. Yes, the low barrier would be good, but we also need housing. I would be completely honest, we just do. And that's one of the ways that we can help with this burdensome costs when it comes to safety net. And I also want to be honest too and put the emotional side of it. Yes, there's a dollar amount, but who would want to live in an emergency housing situation for 2, 3, 4 years? All right, I wouldn't want to, and my heart goes out for those families that are dealing with it. So it's most definitely a high sense of urgency for us as a team to really start getting some developers to come into Chautauqua County and really start developing some of this housing.
You're in contact with the development agency to do that currently, right? Or, it's one of their goals is to promote some of this housing. Have you been talking with it?
Go ahead.
Oh, yeah. I've spoken to quite a few. We had one that Trish was talking about that we're in conversation with again to try to convert one of our hotels into supportive housing. Well, now we're re-engaging in the conversation. So it's the appetite. It's a big thing. I can say this coming from a big city. A lot of developers and agencies like going to the big cities because the dollar amounts and it's a business at the end of the day, a business model, I should say. And it's finding not only the right person with the right dollars or the right organization with the right dollars, but their heart has to be in the right way because these are our neighbors that we're trying to provide services for.
Carmelo is very active too with the Homeless Coalition and agencies such as STEL, which is a development agency, COI. There are many agencies that are part of that he works with on a regular basis and has in conversation with. So yes, absolutely. That's an important part of it.
I just wanted to add, I did look back at that department income projections for '25, and through August, we're at about $58,000 per month, so that $700,000 is a good number for the budget for projecting 2025.
Next, we have our child care and foster care, and as stated, bigger sibling groups be in place. The increase is also attributed to the adoption subsidies. There's been an increase in the number of foster care cases itself, and the subsidy rates are commensurate with the foster care rates. So it's an average, give or take about $80 per diem. And the number of foster care cases increased from 73 to 82.
Is that a trend?
I wouldn't say that's a trend because 2 years or so in advance of that, we had lower numbers. I'd say it's within the realm of normal variance. And as Carmelo did say a little bit ago, that we've had a few cases that are a case, but it's large sibling groups. So a case with a lot of kids is more costly than a case with 1 or 2 children in that family. So that's why, you might see a lower number. A small increase of 10 can make a big difference if you've got a lot of kids, unfortunately. A lot of kids.
Mr. Chairman, I would ask if their cases are increasing, why are our budgeted cost for next year projected to go down from this year?
There has been a decrease in SCR reports in the past year by 10%. So in terms of reports being made to the state.
What's
So-
SCR?
State Central Registry,
Yes.
sorry.
Child abuse hotline reports for child abuse in the home, and which is where foster care cases originate at that point. Does that answer your?
What is SCR actually?
State Central Registry, New York State State Central Registry, yeah, for child abuse reporting.
So sort of child abuse report?
Yes.
Yes.
Okay.
Yeah, sorry. Hotline.
So how do we reconcile the fact that we're seeing more cases but fewer reports, and therefore the costs, the expenditures decrease?
Well, I would say that there are more children that are an increase in cost and a lower number of reports. So the reports it's really hard to say what's going to happen with the number of reports and with what happens with those reports. So the ratio of reports that result in foster care is very hard to predict. I say that this is just a trend prediction based on the SCR reporting. Beyond that, I'm not sure how else to say it.
Okay.
Okay.
Next, we have our juvenile delinquency. Municipalities, we can seek reimbursement at 49% of the costs associated with a secure or non-secure detention of a youth, not to exceed the amount of the municipality of our allocation, which is $367,655.
Anything on that?
Can I ask you a question on the last one?
Yes.
Sure, sorry. So this year, the amended, we're running short this year, right? How do we expect to make the difference this year?
For the foster care?
Yes.
Yeah,
Federal aid.
yeah, federal aid.
Yeah, we would, it looks like we're gonna need a budget amendment. We're not currently over budget as of now, so that's why I don't think we came to you yet, but it looks like in the next month or so, we'll be looking to amend the budget.
And it'll be aided.
Correct, yep.
The difference is we're increasing that budget this year, but it must be in relation to a percentage of, it's a local share increase of 100,000, so that's what the percentage is that we would receive by increasing that.
Mhm.
And you expect you're still projecting it less than what you're running this year, so it still could be a potential, we could experience the same numbers we did this year, potentially, but hopefully not.
Just for frame of reference, the 2025 projection number is just an annualized number from what you've already seen this year.
Correct, yep.
So
It could vary, obviously, it's tough to predict the future with these things.
Yeah, okay. Okay. Thank you.
All right, next we have 6123 RTA, which stands for Raise the Age. And so we budget to provide services for RTA, which is Raise the Age Youth, in the event that a youth presents as in the category, there is no change, is reimbursed at a rate of 100% by the state. So we get reimbursed for 100% state of any youth placed in detention that is Raise the Age. So no questions there. We have our state training. This is for there's no revenue as the county pays net 50% after the state share. We do have OCFS placements, 3 in 23 and 1 in 2024 and 1 in 2025. There's been a year-to-year decrease in expense and local share to be in line with actual trends. Next, we have.
Just a question on that. Are we doing less training? What's the annual?
Well, so state training school is our children who are not placed in the custody of the commissioner of the local social services district. So they're removed and then they end up in a state institutional care under the commissioner of New York State OCFS custody. So that's what we're paying for here, and we're seeing a lower number of kids that are actually entering. So entering that, so that's why we're trending down. Does that answer your question?
It does, yeah. And are we experiencing them in a different category then?
We may be seeing them elsewhere, yeah.
Yeah, and I think a big reason too that it's decreasing as well is because of the lack of places where they can be placed. There's not many of them.
It typically would start in a detention setting, so earlier we discussed the detention budget, not seeing, and it's very rarely that happens. Typically these children are very serious offenders with significant violence involved, so that's a good thing that we're not seeing it.
Agreed, yeah. And who knows, midway through the year, you could get someone, and then all of a sudden.
That's correct.
Yeah.
Absolutely.
So, yeah.
Yes.
So next we have safety net, which we all are very familiar with. The cost increase, it's due to where we're doing 2025, 2026 business post-pandemic, and it's the cost. As we mentioned earlier, housing, we need more of it. Partners and developers to help with this. It's across the state. I hate to say it that way. I've mentioned it before. If you include New York City, we only are 0.49% of the cost. If you remove New York City, we are 2% in what we spend here in Chautauqua County. Even though from one end we can say, hey, we're actually doing some good work out there, but the other end, we all know how expensive it is and the trends, and most importantly, once again, the families that need our assistance. And we got to become more innovative to help provide these essential programs to our neighbors.
I actually have a question on the projection for 2025. The adopted budget was $8 million. We have already adjusted that by $2.5 million.
3.5. Oh, I'm sorry, are you talking about the amendment that?
Yes.
Yeah, so it's 11.5 is what we did.
So the projection is 12.5.
So, as I came to you, obviously, we are conservatively, this is something that's hard to predict, okay? So yes, the projection is trending at 12.5 using August as a number. However, what I didn't want to do is use fund balance, and then we have a good fourth quarter, and we didn't need it. So I conservatively, when I came to you guys, asked for a conservative number, and on hopes that we could hit 11.5 like we did close to last year. So until we get kind of through September and beyond, we'll see. But that's just kind of my thought process on that.
So, just to rephrase what you said in my words, When you did the 2025 projection for the tentative budget in June or thereabouts,
Yeah.
your projection was 12.5. When you came to us with an amendment last month, your projection was actually lower than that. You were a little bit more optimistic that it would come in at 11.5.
Yeah, probably more optimistic than anything else. As of, using August's data, that's what I was hoping for. But also too, we could have a good fourth quarter, and then I didn't want to use fund balance that we weren't going to need.
Okay. Okay, thank you.
Question I have. It's going to be a hard one to answer, I guess, but like, what do you expect it to be in 2 years from now?
But we know we'd like it to be less.
So my point, the reason behind my question is typically we don't like to use fund balance for things that are going to be not a reoccurring expense or cost, right? And looking at the last few years, it is not a reoccurring or one-time expense. It is a reoccurring cost. And this year, we're using a lot of fund balance right up front to put into this. Now, I understand it's to,
I will just make mention first too. Sorry. So obviously, safety net, we have seen it rise and fall throughout history.
Sure.
So this is, we do expect it to come back down eventually.
What do you expect it to be in 2 years? That's my question.
I mean,
I would say that what we need to look at carefully are the case trends, and look at what the expense mix is on those case trends. Right now, we see a very high housing case expense on the trends, but we also, I've seen in the last maybe 5 to 6 months, somewhat a stabling of the number of new cases coming into safety net, and that's what we need to watch, is how many cases are coming in? Is it stabilizing? Is it stabilizing? Or are we seeing an increase again? I think in the next couple of months, we need to watch it because winter's coming.
Yes.
So, and it does have an impact on the cases. So I would say that's one of the most important factors that we'll need to look at in predicting what the next 2 years is the case trends. If we continue to see some stabilization on those case trends as we've seen in the last few months, then we could be in better shape.
The trend I'm worried about is utilizing fund balance this year.
Right.
Yes. Utilizing fund balance next year.
And then what?
And then next year, and then next year. Yes. And at what point does the fund balance really, it's really taking a hit, and that's not what the fund balance is intended for. So that's, it's important that we bump it up and then take it, if we have to, take it back down, but.
and we have continued to increase it as well. So if you recall, a couple years ago, it was at 4 million, right? So now we're 8 in 2025, we budgeted, and we're budgeting 10. So we are doing the best with what we've known for the last, 15 years. We have seen the ups and downs, so it is something it's unquantifiable to see the trends, really. I mean, there's a lot of factors that are limiting our ability to forecast this out.
Yeah. And as, if there are housing projects in the works, as those come online, that can make a difference as well.
Yes.
Sorry, I interrupted somebody.
No, I would support since you've got an overall rising budget, I would support your budgeting aggressively. But one of the things, and correct me if I'm wrong, Mr. Chairman, but I get the impression that when a department runs over budget in a year, that department looks for offsets. But if they don't find offsets, it then tends to go to the fund, as opposed to kicking it up to higher and higher levels. So we eventually get to ask the county executive, how are you across your entire budget going to offset this particular fund somewhere down the line? And in my private sector where I come from, that's how that would do. As you're a division president, somebody in marketing busts their budget, push comes to shove, somebody in manufacturing's got to cover it if they can. And it's only after you've exhausted that do you go hat in hand to corporate and say, whoops, I'm not going to make my budget. So I don't see that happening around here.
Yes, Nancy.
Chairman, I can just like to add a couple of things to the conversation. I just asked Sam to get some copies of something, but in terms of how long over a 20-year period, the safety net trends do tend to move slowly, but they do go, from 2005 to like 2010, the cost doubled. Then it kind of leveled off a little bit, then it dropped down back in half. And now we're seeing that spike back up, doubling again. I expect it'll take, once we get to where it's going to plateau, it might be plateaued for a couple of years before it starts to drop back down again. It does tend to lag, the changes in safety net do tend to lag behind what's going on in the economy. That's just been my experience. So, right now, or in periods where maybe the economy is starting to do better, that's when safety net's going up, and it doesn't make sense logically, but there is usually that lag.
I would totally agree with that based on my experience with safety net too.
Yeah. So I had just, for my own curiosity, put together, and I know they have similar
We have
charts,
similar,
but
yes.
just showing the 20-year trend in safety net expenses with some averages down below, but that's just for your info. And then related to, throughout the year, as you may receive copies of the dashboard on a quarterly basis, that's where we're kind of keeping in our higher level understanding where we are countywide in terms of, safety nets, a deficit right now, other areas where we might see a surplus, or any material variances that we know of within the budget. But it hasn't really been the position, even at the end of the year, in making budget adjustments to take from one department to offset another department. Over the past maybe 10 years, the position has really been to show the single department's variance, so that is known rather than, and so then there might be a surplus in this department, but the other department is showing an offset, but we know countywide, what the net is going to be. But the amendments don't tend to be from one department to another, and that's just been a matter of, position. But if that position can change and we can start doing that, it's just been what the practice has been. That's not to say that we're not monitoring things across countywide departments.
And I'm hoping, to answer your question, in 2 years, that with, as Trish mentioned at the beginning, with the Crisis Stabilization Center, with the Wellness Center, hopefully the expansion of the Family Center case management, and also the balance of state with the housing part, that we can force it to plateau and then start chipping away and working backwards, or we can get it down. Are we going to end homelessness overnight or emergency housing overnight? No. But we could try to make a dent in what's needed, the supports that are needed in order to have a place to go. One of the biggest things that we're seeing, and just going to be honest, is individuals that comply, doing everything that they have to do, get stuck in emergency housing. Is that transition from there to stable housing? And that's what John is mentioning in terms of the needing those partnerships into more housing.
Chairman, I just have a question. Carmelo, do you collaborate or participate in any inter-county groups that are seeing better results in safety net, or like and I know everyone hates studies, but I mean, have we ever participated in a study to get a comprehensive plan? You mentioned that the expenses have flipped from one thing to another. Mm-hmm. Are you getting any assistance from the county or from us for helping you with this plan that we want you to come up with?
Well, that's why we moved into the balance of state. Before it was done individually, Chicago County, but the balance of state now allows us to do exactly what you stated, comprehensive plan and an inter-county of we're all facing the same thing. From what I've noticed from with the commissioners of all 62 counties, we're all facing the same thing, just some counties, fortunately for them or unfortunately, depending on how you look at it, like to put a little bit more money into it, in the sense of they don't mind raising, like New York City, for example, the amount of shelters that are up in New York City that they're just utilizing so much tax dollars for, and they still have about 4,000 street unhoused homeless in their costs. But coming from New York City, I can say this. I interned at a homeless shelter, and I saw families there for 5+ years. that couldn't find affordable housing to transition to. So that was hitting their safety net. So it is interesting, and it really depends, and it's about getting creative. I am meeting with Jefferson County, who does have a really nice comprehensive plan. My first question is, how did you fund it? My second question would be, okay, where did you get money from, or how did you do it, and what can we do here in Chautauqua County and make it our own?
Right, like to Dan's point, like, let's fix the roof first. If we have to
Yes.
give money toward, a study or a plan or something like that, that can make all the difference in both budgeting and in the lives of our community, I mean, I think we should look at that.
Chair, I just wanted to also touch on the comments related to the use of fund balance. So
Yes, please.
any use of fund balance in the proposed budget is really discussed more at, the county executive level. It's not a decision made by any of the department heads themselves. But the thought process there was, as, mentioned in the overview, and I think the county executive's presentation too, we funded half the increase, just for that point. We know it's not sustainable to just fund it every year, but knowing that at some point it should start to come back down, we made the rationalization that that would be a good use of fund balance, but not funding the whole increase. But we'll also be reviewing all the uses of fund balance tomorrow in the Admin Services Committee. But if you have more questions right now, I'm happy to answer them, but.
Okay, on this graph, I thank you for it, it's great. Is that dip in 2020 partly a function of all the PPP money that came out and ameliorated the situation for a while?
Yes.
And then it's gone away?
Yes, it is.
Well, and they could not evict.
Correct. There were no evictions happening during that period.
No, that's, yeah, okay.
Yes.
The other one, what I was trying to get at was, if we as a county go back to our taxpayers and say, our budget is, pick a number, $300 million. Do we make all the cuts necessary across all departments to meet that number that we can before we start invading the fund balance? Or do we just go straight from department to fund balance when we have a gap?
Are you talking about like during the year?
Yeah, during the year, because it's that during the year thing that then drives the projections that are driving this budget.
Well, I mean, because the position has been not to make adjustments from one department head to another department head. And if we do ask the department, if they're coming in with an amendment, and I did say, hey, do you have any offsets before you came in with that safety net amendment this month? We want to use those offsets first. So that is generally what we do. We don't just say, hey, you have a variance here. Not every department is like, this department that has multiple different departments and sub-departments. I mean, my department, there's just one or two accounts, so, but, yeah, we generally look for them to find any savings within their existing budget that could offset an increase before we're using funds.
But what I'm hearing you saying is if you've got an expense overrun in Department A, you'll ask that department to cover it, but you won't. Nobody goes back to Department B and says, you know what, you need to tighten your belt to cover what's happened over in Department A. We don't do that.
We don't generally do that, but there have been years where we are concerned about our financial position, so we will maybe across the board hold back on hiring. We might hold back on procurement of discretionary spending. So if we are seeing a significant material shortfall in one area of the countywide budget, there have been times where we will start to communicate to all department heads that we need them to pull back on spending.
Okay. 'Cause what I'm getting at is when we get all said and done with this, is our budget a commitment to our taxpayers and constituents, or is it just a budget?
I would like to think it's certainly a commitment, and, department heads do have the responsibility to manage within their budgets. Some things like, the example of safety net, that's kind of a whole nother category of things, where we have discretion, we certainly, but there was, at one point in time, long ago, we might have budgeted, like, say, a factor for contingency in the budget. So we have a contingency. But we took that out, that was taken out, with the understanding that if we do have a need to amend the budget during the year that can't be offset elsewhere, we would utilize fund balance at that time, rather than raise taxes for a contingency. So that was the rationale at that point, and that's just continued. I think the only other time we used a contingency was maybe during COVID, one of the budgets during COVID.
And Kitty, good responses. Let me just elaborate on what you said about what we have done in the past several years. When the pandemic hit in February of the year, we immediately sent the message to the department heads, you got to cut your expenses. We don't know how bad this is going to be. And we managed that month by month by month by month through the year, because we knew it was going to be a dramatic impact on the county. Safety net is one account in one department. We haven't responded to it in the same way, but your point, I think, is that when we know that we have risk in the budget, we should be perhaps monitoring it more closely month by month.
And doing something.
And doing something about it, yes.
When and where we can.
When it's justified, when it's rational.
Can I just point out too, is we're expecting it to plateau. We aren't expecting it to decrease $2 million, correct? So we probably are going to realize that it is going to be 11.5, 12 million next year, and we're only budgeting 10. So where's the extra money going to come from next year to make up the difference again? Okay? And, history has shown that we have under-budgeted it for the last few years. And every year I advocate and say that, but we under-budget it. So it's just, where's the other, where are we going to project that we're going to take the rest of it next year from?
And
Fund balance?
what I'm saying is, I'm okay with you budgeting it tight, as long as we have a countywide commitment to deal with it in terms of expense reductions. Otherwise, if in fact their case does not pan out.
In tight, Fred, is not, we haven't been tight, we've been under, that's my point. Tight would be 11 million. Then it would be tight, because we might be able to cover it, we might not. 10 million, I don't feel that we're going to cover it. And if you feel that it's tight, don't come to me for a $2 million adjustment next year, because that's not tight in my eyes. Tight would be, we need $200,000 or we need $500,000. That's tight,
However, these are mandated services too, so.
Understood.
There is a uncontrollable factor, unfortunately, with this department in safety net.
But what I'm saying is different than you, is I'm not looking at this department to cover it.
I understand.
I'm just going back at the county executive meeting and saying, okay, if these guys don't make it because of this graph, then we as a county, and that includes us as the legislature, are committed to offset it somewhere. And
We're going to increase the revenue by 500,000 in heat, and that'll help offset it. So that's, I already know one offset, but.
Now I'm in trouble.
I think it was 2 years ago, to your point, we kind of knew the safety net was going to come in higher, but we didn't adjust our budget for it. And sure as shooting, it did come in higher. So are we doing the same thing here at 10 million when we should be putting 12 million in? I mean, do we know it's going to be 12 and we're only going to budget for 10? And is that
Yeah.
I'm just throwing that out.
No, and it's a fair question, and what I'm saying is if we don't fix it here, I'm okay with that, just as long as PJ is committed to fix it somewhere else.
And I think that's a big fix, $2 million. Yeah, I'm okay with that. Let's go 10, goes 12, and we fix it within for the 2 million, but are we, I mean, that's a discussion we can have when we're figuring things out, but I just remember clearly 2 years ago, and then we said, we're not gonna do that last year, and we didn't do it, and we still came in under, we needed to increase it, so just thought for down the road, or today, or.
I'll leave that up to you guys to decide.
Yeah, thank you.
Well, and I guess, the most accurate projection that you can have is the relevant ask, and that, I know it's.
And I'm not criticizing
No,
the projection, I'm just saying.
And it changes month to month. I mean, it really does. So, I mean, week to week even. I mean, there's times, from when I was up here last explaining it, it's tough to predict.
But we're all good with putting in 12 and it comes in at 6.
Yeah, I mean.
Well, no, actually.
Well, no, I mean.
It's
okay.
tough to predict.
But here's the thing, what I'm trying to get at is, when you're speaking to the legislature with the budget, it's a commitment. It's not a projection, it's a commitment. And that you will take affirmative action to meet that commitment, and often painful action, if you have to. It's not just, oh, well, the numbers change. Hell, in farming, the big guy upstairs throws us curveballs all the time. And we still have commitments to shareholders to meet. It's just, you do your best numbers best you can, and then you make them happen.
There have been, just for some other perspective, and we have been increasing the safety net budget. Just back to 2023, the appropriation budget was $5.5 million. And, we've seen steady increases, so we have been increasing it. Obviously, we've been, maybe optimistic, but we have been taking steps to right-size the budget for this account, but I don't expect it to stay up there forever, so that's where you have to balance, whether you're raising taxes up to here, or kind of trying to keep them steady so that they, kind of eventually meet up with each other.
And I will say, that's why it is important to have a healthy fund balance. And in instances like this, I know we got some criticism last year when we were looking at a targeted number of 12.5%. But we do that for a reason, so.
Well, and to maintain that healthy fund balance, we've got to quit using it, too, as.
Hopefully, I'm not talking out of pocket, but.
Yeah, but, I mean, it's sustainable with, to what would be, you want to be able to return the tax dollars, when you can, and you can't, we wouldn't want to do it just for regular operating expenses, year to year, but kind of gradually return the fund balance to offset, what could be deemed temporary increases.
Well, the good news is safety net is very unique.
Exactly. This is a
I'm so happy all week we don't have a safety net every 45 minutes.
I feel like we do, though. It seems like.
This is kind of unique to our week, if I can say that.
And we are increasing it.
Yeah.
But I'm going to say, is it enough?
And from the program side, I agree. Safety net is something that we, unfortunately, us up here, we look at it every day. And the more it goes up, that means the more our neighbors need, which means that we got to bridge the gap somewhere. So I also see it from that perspective, and I always scratch my head and go, man, why do numbers keep going up? What else can we do? What else can we help with? So I agree with you.
And I also hear we try to keep safety net from going up by providing other programs. But
Absolutely.
if the other programs are going up and the safety net's not going up, we're still spending more to spend less.
But providing
make sense?
better services,
Which,
more sustainable, long-term services.
16 years ago, I wasn't as much of a fan of spending this money as I am today. And part of it is being here in these budgets and hearing what's being presented. So I do appreciate the work that's done, and I think it's necessary that we take care of those that are in need. So I'm in no way against.
Oh, no, no worries.
I'm just saying that we need to be realistic and have it at 12. I'm going to say that for the last time. So we need to be more realistic in our projection. And that's not a knock on our projection, that's just, okay, I'm done. Look at that, I didn't talk all the way, you know.
Just a data question, workforce participation rates. I know we can get them at state level. Can we get them at a county level?
Yes. And I think the Human Services Committee gets those on a regular basis from Diane Anderson in a quarterly report that she provides in person here, along with the Workforce Investment Board
All right,
Director,
so-
Katie Geis, I think.
So workforce participation rate, especially males 25 to 55, somebody point me in the right direction. I'd love to find how we rank against other counties.
We can provide you that.
Okay, thanks. Because if we can fix that, we can fix some of this.
Anything more on safety net?
All right. So we have aid for adults. This is emergency assistance for individuals receiving SSI. So this helps with utilities, eviction. The department takes some of their SSI to offset some of these costs, especially for hotels, but it's not fully funded.
How much is it funded?
I'm sorry.
8.
Looking for your, what tab are you on, emergencies? 6142. 6142.
Yes, 6142.
I'm sorry, what was your question?
You said it's not fully funded, but how much is it funded?
Emergency aid for adults.
I mean, percentage-wise.
Pretty high, but I'm not sure exactly what the percentage is.
Just
Sorry.
curiosity.
Do you know?
Yeah, it's 63,500.
60.6%.
About 60%. Which is generally, you know, for many of the programs, it seems to be in the 62, 65% range. Other than those that are funded at 100%.
All right, next we have our youth programs. There is a change in our allocation, also an increase in the allocation that we receive from the state. So there's an 18% increase in the expense shown due to increase in contracts, as John was mentioning earlier, which is offset by the increase in New York State's allocation by Office of Children for Family Services. Allocation is contract for positive youth development activities and our runaway and homeless youth program. This includes the Safe House, and there was a decrease in personnel allocation. If there are no questions there, next we have Medicaid. Federal Medicaid. Okay, so our federal FMAP, Federal Medicaid Assistance, went away in quarter one of 2025. No. no questions there.
So, anyway, why have, if the Fed's gone away, why hasn't the state stepped up to cover it?
I'm not sure of the answer to that.
Sometimes, when things go away from the federal side, our state likes to continue running it. And then it becomes, as was mentioned earlier, I believe you mentioned it earlier, the cost shift. So the cost could shift from the Fed saying, hey, we don't, this program, we're shifting and we got different views and ideas on it. And the state goes, well, we still want to keep it because it's working and we're going to shift how we charge the cost. Or we're still going to implement the program, but county may have to pick up 35%, 40%, sometimes 70%.
That's right, and it was certainly a rhetorical question on my part, because this stuff is coming on downhill, there's more of it's coming, so.
That's right.
Yes.
Okay, I think we're scheduled for a break right now.
I only got one more for DSS.
Oh, we do?
Yeah.
Hurry up.
So last one, medical assistance.
Oh, okay, yeah.
This is our intergovernmental transfer. So Kenny could explain this a lot better than I can. So money comes into the Department of Social Services that we have to give to the Department of Mental Hygiene.
It has to be funds that are to offset some of the expense associated with operations of clinics that are run on the behavioral health side, and we're required to do that from the Medicaid dollars that are on the DSS side directly to the mental hygiene department. So it shows as an expense on this side.
But it's gained revenue on the mental hygiene side.
It really is the accounting treatment of the state chart of accounts has to show the expense in this account, but because there needs to be a local share cost in order to get reimbursement for the clinics, and the accounting treatment is just that the expense shows up in this social services account, where the revenue shows up in the mental hygiene account. But it's a net positive for the county.
Any questions on that? Apologize, I got lost there for a minute. Okay, guess we're scheduled for a break. And we'll get into mental hygiene. So we'll be back here in 15 minutes.
1 o'clock.
Let's make it 10 minutes, 10:47. Go back. Okay.
Well, now that I see that I'm looking,
Okay, all you animals, get back in your cages.
I just had an idea on this, I need to upgrade my prescription.
Hey, get back here. Absolutely.
Is that a tulip? There you go.
Was they subtle or not subtle? Yeah, hey you. Okay, we're back. Mental hygiene.
So Carmelo Hernandez, Commissioner of Mental Hygiene and Social Services.
And Trish McLennan, Deputy Director, Mental Hygiene and Social Services.
Kimberly Latone, Fiscal Supervisor.
John Anderson, Deputy Commissioner, Social Services.
Blake Erie, Director of Administrative Services.
Okay, thank you.
So we are here at our FTEs for mental hygiene. You will see an increase is due to community needs per New York State, as well as a decrease to contracted employees moving to county employee positions. These positions are funded by clinic revenue. All right, so as we see here at 4310, we have per CBA contractual raises. Most of our equipment was upgraded previously, therefore expecting a reduction in equipment needs, reduction in off-site trainings. This is due to Trish. We've been monitoring our training and seeing how much that we can do in-house, but also to see what could be most cost-effective. And we have an administrative payment from Honey, which is Health Homes of Upstate New York. And you will see our state aid here as well, and our federal share.
Any questions on that?
All right, and here's where we were talking about the 6 peers who would be revenue producing. They were contracted employees because the position did not exist within our county in terms of county employment. We also have, which is fully funded, the court navigator position, which is fully funded by OMH. Then we have our equipment. These projections are based on IT. During 2025, computers were upgraded, and we expect, as stated earlier, less upgrades in 2026. Once again, we're placing our contracted employees as county employees. In 2026, this will be less, once again, the less off-site trainings, the contractual raises. If we can fill all of our vacancies, the revenue will be attainable due to vacancies that our revenue is lower in 2024 and is lower in 2025 projections. The financial structure has helped us identify inefficiencies that we have, especially within our billing, and things that we can improve on and do better. And Trish, once again, has sold some vehicles that has helped us with cost savings there, believe it or not. And we also have our lead health home funding. We also have opioid settlement funds. So there's 2 kinds. There's opioid settlement funds that came to the county, and then there's another side of opioid settlement funds that came to the local government unit to mental hygiene. And of course, our Tapestry and CCBHC grants that Trish could speak more to, if there are any questions.
Can you just go the revenue producing peers?
I can speak to that a little bit, absolutely. So currently, just making sure we're level setting what a peer is. I know that can get confusing. What a peer is, they have state positions, other counties are using them. It is an individual who's had lived or shared experiences. So in our field, it's a person who has had and is now on the other side of that, lived or shared experiences with either mental health issues or substance use issues. And now they are certified. It's a state certification. If they're certified through substance use issues, they're certified through OASIS, which is our Office of Addiction Services and Supports for New York State, or through Office of Mental Health for mental health issues. What they're really good at doing is engaging a person at the level where sometimes, if you think about some of our folks, they may have received sanctions through social services, they may have been kicked out of treatment before for certain behaviors, and what a peer can often do is say, hey there, been there, done that, come with me, let's get going. And they can often get them to do things that other professional staff cannot do. So peers has been proven to be a very effective way to engage clients, to keep them going. They also can, under New York State, they can bill for the services. So when we say revenue producing, it means just like a therapist in our clinic, we bill under them, the peers will also be billed. And they are currently billed. So we are showing that we're able to break even or come up ahead by having peers in our clinics. So that's what that is. So they'll be in the clinic plus the mobile crises team is what you'll find them on.
Who do we bill?
Insurance company. It's just like we do for all. So these are, what we're talking about is actually, so when we're saying the clinic, it's our outpatient mental health and outpatient chemical dependency programs. So when clients come in, whether it be Medicaid, private insurance, if they're seeing a peer for a service or a group, we bill insurance for the peer service. If they're seeing a nurse, for the nurse, just like you would your family medical doctor, but depending on what service they're receiving.
But, so it either sooner or later goes back to taxpayers or the insurance rate?
Insurance company, absolutely. And that's how, yes, absolutely. Will not be a county share, though. Just like, I mean, the whole point is providing the services, so you've got the recovery, so you actually are having the outcomes we're looking for, which is less readmission, less recidivism, less jail. There's just an article that Dr. Falk sent around showing the impact of doing medication-assisted treatment in jail, that it can have less recidivism. I'm sure I may have already broken his thing, but he's going to want to talk with you later this week, but I'm sure he'll be sharing that. Yes.
But my point is, it's not a freebie. It goes back on my taxpayers, either as a tax, state, or as an increase in their insurance bills, one way or another. This is not a freebie. This is maybe productive, don't get me wrong, but it's not free.
And I think when we say this, anything is not a freebie. So in other words, if I go see a doctor today, it's not a freebie if you're saying that, even though I have insurance through the county. So if you're comparing it to that, yes. If you're saying, is it going to come out as a local share, anything like that? No. These are services that, yes, just like anything else. If we open a restaurant, is it free for the county? Probably not, because you're going to have some taxes. You're going to have land use. You're going to use electricity. You're going to use power. You're going to use resources. So anything like that, it's just that our resources are the human resources, is what we use. So yes, when we say neutral, that's what, in the finance language, we mean is neutral.
Sure.
Neutral is that we're not charging back out. We are billing for that. And then in some cases, we also receive, which I recognize ultimately is not free, we do receive startup funding often for some of our positions too from the state to offset the costs of just bringing in a new person. So like for school counselors, we receive about $40,000, and that offsets those first few months when someone is training, building up a caseload in that, so that it's not coming back to figure out how do we find it in the budget.
Same thing with the court navigator positions as well. We received from Office of Mental Health $250,000 to be able to start that up as well.
And that, even though it's, again, is anything free when it's funded? Of course not. But what that is partly what that's intended to do, and that'll be the next page, is hopefully to start to offset some of those 730s that will explain what that stands for and what that means. Several of you have heard these ad nauseum every year, a couple times a year, about what that means. But one of the responses from the state, after every county has said, we can't afford this, is let's look at how do we prevent it. So having a professional court navigator in the courts through us is one of the ways they've approached that, and that we're starting up. And we'll be looking at outcomes, and that will be measured outcomes. So we're looking at, is this program working? Is it effective? Do we just do it for the sake of doing it? Something like the court navigator has very specific reportables, data to see, okay, how many did you see? How many referrals were before this? Now how many are we at? How many 730s? how many referrals to the state hospitals are we getting that the county is paying for. So you'll see, so if you're interested in it, we'll be glad to share the data down the road once that starts up.
I have a question. What is Tapestry?
Oh, that actually the name of our system of care grant. So for about 8 years now, it's a federal grant. It's one of our 2 federal grants. For about 8 years, under Rachel Ludwig's guidance, we have had what's called Tapestry. If you think what a tapestry is, the reason for the name, it's woven. So what the idea of this is a system of care grant. This time it's for 0 to 21-year-olds to help provide services in the community, trainings, wellness events. And what this does is actually pull communities together, it pulls families together, and it has had such a positive effect of our county. I will say Rachel's been asked to speak at several national conferences to show what we're doing differently and why is it working. And that's why the county's been awarded it on her behalf for 8 consecutive years. So, good question.
Thank you.
Mr. Chairman, I have a question on the revenue. Okay. You indicate that there is the opioid settlement funds.
Yes.
Could you tell us how much opioid settlements funds are included in the revenue?
The opiate settlement funds are under the section of the New York State Aid. Sure, I don't want to speak. So that's under RE 20, and that we have received approximately, I'm going to be overquoted in this one, I want to say 2.4 total million. As far as spending, this is the one that will now come for a resolution to accept the funds. There's not a deadline. Like ARPA has it by December and others have by, so we have not spent it all by any stretch. We've spent part of it in schools with Prevention Works. I know I've talked about that. And we've also committed to, but not spent yet, for the Wellness Center, which is the low barrier shelter through Rome. So that's where that is.
But there's money included in your 2026 budget for the opioid settlement funds?
And that is not to achieve anymore, but to spend out.
Okay.
So we're using it and then spending it.
And can you tell us how much is included in the 2026 budget for opioid settlement funds?
We've predicted 900,000, 800. 900, yep, I was right. 925,000 we're projecting to use of that funding in 2026 because we are anticipating Rome to be ready with the Wellness Center to be using that.
And those funds have not yet been allocated?
Correct.
That's
Some
correct?
have been allocated. We've received them all, but have not allocated all of them.
Right. So the legislature still has to allocate those funds to that purpose?
Actually, for these funds, the way these funds work is you don't necessarily allocate them like you do for the county funds. What we do have to do is have proposals come in, and then we look to see is usually proposals. The Rome one is very high. That's the 1.4 million. The others are usually about $40,000. Just talked to Prevention Works too. They've submitted a new proposal, so it goes through the proposal process of an RFP for these funds. So we're submitting an RFP out, have the best bidders come back, and then utilize them that way.
Okay.
And then they do have to be listed on our website starting 2026, how we've used the funds. So you'll start to see that as well.
I'm going to look at Kitty, and can you explain why the legislature doesn't have to allocate these funds?
So there's 2 different opioid settlement components. So under mental hygiene, that is allocated to the local
To the LGU.
LGUs from the state's opioid settlement funds.
Okay.
Yes.
The county's opioid settlement funds are accounted for elsewhere in the budget. You'll see that in the miscellaneous department, and those to date have been used mainly to offset the MAT program under the health department. So we'll talk about that more under the health department presentation.
But Kitty, you just answered my question. These are not county opioid funds.
Issued to us by Office of Addiction Services.
And they still have, similar requirements in terms of how
Report it
they
out.
can be used.
Yes.
Yes.
So any unspent share just stays like in a reserve until it is recognized in a particular, so they're utilizing of what we've collected to date. The balance stays in a reserve until it's appropriated in a budget or through a budget amendment based on what the planned use is for it. So there's no timeline in which to use the funds, so they stay in a reserve until they are appropriated.
Thank you.
Yeah, I do have a question. I'm a little confused on that because last month we had a gentleman here, and one of the questions was asked, when will we see some of this money? And he said he couldn't answer the question, so I'm a little confused on what you're talking about.
Those were the county funds, so the Purdue settlements, so those are new settlements, and those are funds that will come to the county directly, and until they know how many participants are going to be included in the settlement, they don't have a way to tell us yet how much our share is going to be for that particular one, but there's probably at least 10 or 12 different settlements that we get funds from through the opioid litigation,
So the state already knows what they're getting, but we as a county don't know what
But
we're getting?
on that individual settlement, okay, there's multiple settlements. So the ones that were just passed this last month in the legislature, that has to do with the Purdue Pharma settlement. There's like Walgreens, CVS, Teva, there's like I said, there's probably about 10 different settlements out there, but of the ones that have settled so far, we do have a schedule. But this new one, we just don't have the schedule yet. At some point, they'll produce a schedule for us, but they usually go out 10 to 20 years.
Okay, thank you.
So, I get the accounting. It sounds to me like these settlements are kind of like the ARPA funds, which are a one-time deal.
Yes.
And with ARPA, we made quite an effort to fund one-time expenses with the one-time revenue. How are we managing these settlement funds to make sure that they go against one-time things and don't end up in our expense base?
We're doing the same thing. So for the OASIS, so I can speak, and again, for this meeting, I'm just going to speak about the OASIS funds that came from the New York State Office of Addiction Services to the LGU. Okay, so for these, there's a whole lot of requirements we have. In fact, we're in the middle of an audit that every county gets from OASIS to make sure we're using them accurately. There's 10 categories in which we can use. Part of the plan has to be a sustainability plan. So when someone submits a plan to us, there has to be a plan for sustainability. So for example, with the Wellness Center, much of this is about construction and startup funds, and then there is opportunities for, just like other shelters, to receive other funding. They submitted that to us about a year ago with a sustainability plan. We met with Finance too as part of that plan to ensure that their plan was legit. OASIS also accepted it, and New York State, OMH is also involved in that as well. So anything we're doing has to come with a sustainability plan or we don't accept it. You're absolutely correct. If we just give it now, at the end of it, they're going to say, well, it's nice. Now what are you going to do, county? And that can't be the answer. So our plan for this type of funding needs to be, how do we get things going? So for some of the school ones, it's a train-the-trainer plan. So you're getting other folks, the experts are training school teachers, school personnel to help implement. And that's part of the model of that. It's an evidence-based model.
What I'm hearing is not one-time expenses, but startup expenses, which are then going to have their own expense trail going forward.
But
am I misinterpreting what you're saying?
partly, it may be. Now, there also may be, for example, some of the opiate settlement funds went to lockboxes. That's a one-time. So what a lockbox is for somebody who may be at high risk for suicide is they lock their guns and medication in that. That's one startup fund. We use that with and it's a evidence-based, because it reduces impulsivity is what it does. Many cases of someone with suicide is impulsive, so it's delaying the time between the thought and the action. So that's a one-time. Other things may be startup, but they're not our continuing. So that program has the ability, and they've shown that historically, to continue what they're doing. without our need once things get moving, whether it be curriculum purchases, whether it be starting with staff, startup funds with staff. Kind of like the state gives us $40,000 to start a new counselor in a school. The expectation is then, if I accept that, I have to be committed to keeping that counselor and be able to fund it myself without the state. So if I can't prove to the state I can do that, they're not going to hand me $40,000.
All right, but my ongoing expense then is after the 40,000, I got to fund that counselor.
Now, yes, we do, but we do that through fund, yes, and then we bill for it, so I have to show how am I going to fund it. In this case, these aren't ours. What we're doing very carefully with opiate settlement funds, and this is under our county executive Wendell's, I think one of my first or second meetings with him, is making sure that with mental hygiene especially, that we are not just hanging on to everything and deciding we're going to provide every service. Because we do have a lot of other good, very qualified folks in our county. So part of what we've been doing, you won't see, you're up to date now, any of the opiate settlement funds have not gone toward county programs. They're going to other programs that may need some assistance to get it going, or to start it, or to continue it, but then they have to prove this is what is going to, and they have to prove through data. So like for the school ones at Dunkirk, I've got the data in my office quarterly as to the results, the outcomes. So that's what we're looking for. So yeah, with mental health and substance abuse, you're often looking at how do you get the system going so you can have folks coming, and then the outcomes you're looking for aren't just the system going, but you're looking for the behavioral health outcomes. That's why I mentioned the hospital. Are we looking at decreased, so you can look at a program called Psyches, which is a Medicaid, based on if a claim was submitted through Medicaid, I can see. So what I'll be able to see, and think of this with the jail too, I could look up anyone on Medicaid to see if they used the hospital ED within 30 days of release from the jail. So did a program we put into place, because we're involved with the MAT services too, did it have a positive impact on the outcome?
So, again, I'm asking a more financial question, which is not whether or not the program is going to, or the spending is going to have a long-term benefit. I'm just simply asking, is it going to have an expense tail?
Not with the county.
Either on the school budget or on the state budget or someplace?
No, none of it. Well, no. It's the agency running it. So the benefit it may have an increase in workforce.
Sure, but that's the benefit. Fine, I'll take your word for it.
But no, but not an increase. But no, they will not. They have a plan to be able to continue it once it started.
So it funds, like your school counselor, it funds itself how?
Through, we bill the insurance company, just like we do for everyone else. So that kid is no longer coming to the clinic, they're getting seen in the school instead.
So we have started up a program that is going to increase insurance claims on the cost side. I'm not talking benefit side now.
Possibly, or have the insurance claims in a different location that is better suited for the family. And you may actually have less insurance claims, because when you don't do that, you end up in the hospital at a $1,200. So that's the financial piece, though.
No, we're on the benefit side, but it's...
Well, to me, that's the financial side, because what I want to do is, so forget the wellness, forget recovery. I can't believe I'm saying this as a counselor. Forget recovery and wellness. What I want to do is cut costs, the county as a whole, not just our county government costs, but county as a whole. So right now, we use a lot of Medicaid dollars in emergency departments, a whole lot. We use a lot of dollars with law enforcement. You talk with Dunkirk and Fredonia Police, and those of you from that area, I know you've heard this, of a lot of transports from North County to South County that then may leave one officer there instead of two. If we can actually, and that costs money, and it costs overtime, there's your money. It may not be county government, but it's county. It's Chautauqua County, which is what we have the responsibility. That goes back to the LGU. Our responsibility is for the whole county, not just county programming. So the cost piece, believe it or not, really is important, and that is some of what we look at. How much overtime are we paying for this? When I talk with Chief Bukowski, that's some of what we're talking about, is how much overtime did he put in transporting individuals to South County Hospital. If we can actually see somebody in North County and prevent that, I've just saved money for this county. Now, it may be money through Medicaid billing, or it may be an overtime cost, but we just saved money. Forget the wellness. Hopefully, it's going to do that, too.
No, I understand all that, but what I know is, when you commit to spend money, that's a hard number, and very hard to cut. The question is then, what benefits do we have to track to make sure we get paid back? In this case, you just mentioned overtime. But I just wanted to know what the hard costs were without.
Yeah, and if you're looking at Chautauqua County government, there is no additional after this cost. So the opiate settlement funds will go to agencies and organizations with no additional costs, zero commitment afterwards to the county government budget, if that's the more direct answer.
Okay. And I understand that there'll be tail costs somewhere else.
Yes. Is there anything? For us, that's our program. So all of this whole page includes state aid, includes federal, includes clinic billing. It's all of that. Are there any additional questions on our programs?
I guess one thing on the opioid settlements, was
Sure.
one of the requirements it be invested in prevention programs?
Yes. Yep, absolutely. That's the Dunkirk schools, by the way, that I keep mentioning. Absolutely. And she
So-
just met with
so
me
you-
and submitted a new proposal for next year.
So they're required for prevention.
You got it. Yes, sir.
Anything else on that?
Glasses are 730s. This is where you see the local share. This can vary for the simple component of. Yes.
Can you explain the history of this? Because I'm not sure.
Oh, yeah.
That's important.
Oh, most definitely.
We have some time, so.
I think it was maybe 2 years ago, or a little over 2 years ago now. It used to be a 50% county share, 50% state. So when individuals are a male or female, they get an assessment, and from that assessment, incarcerated individuals get this assessment, and they say, hey, they're deemed to see if they can get restored to be able to understand the charges that are being filed against them. They end up going to our state hospital. So in the past, as of 2.5 years ago, it used to be a 50-50 cost split between the county and the state. State changed that, and the state made it 100% the county. I believe it was in April of 2023, I think, or 22, to be quite honest.
Through the state budget process.
Yes, so that put it more on us. Then there was another piece with it as well. Individuals, we would know when they would go, because we are helping administer the assessments and things of that nature, but in terms of how long they were there, that's where it got real interesting, and there was a lot of conversation at the state level. Because an individual, it's about $1,300 a day, give or take, $1,200 to $1,300 a day. Individuals there for a month, we're talking about $32,000, $33,000 easily. And you don't get the bill right away also. Sometimes it takes them about a month or two post-discharge to receive the bill. That's another component to it. This is where the court navigator piece that Trish was talking about is essential in the sense that we'll be working with the criminal courts, the judges, public defender, and the district attorney, and being able to catch some of these on the front end and also do a tracking system. A lot of this is education, believe it or not. A lot of judges were saying, hey, we'll just do a 7:30. The biggest issue with this, and I'll share it, I have some counterparts that unfortunately lost track of an individual, and they had to end up paying $10 million back to the state. That's one example, because the person was discharged, they had no idea that the person was even there and for how long they were there. So one of the things that we're advocating for as DCSs at the state level with all our counterparts, OMH specifically, is what does restoration look like? There are cases where we know the person is not going to be restored to competency. Intellectual disability, you got IQ, some of it is substance-induced, some of it is just the way they've always been. So it's really doing those diversions and saying, yes, we know that the person qualifies because you did the assessments and the assessments were done,
but we also know that restoration is not going to happen here. It's not possible. So that's where the 730, infamous 730 comes from.
Okay, thank you. So we're reducing it from 750 to 500, and 250.
And that's based so far on what we've used this year.
Yes.
So we're rather than and what we're anticipating using. There was a decrease this year over 2 years ago. I know last year, 2024, it was 647. We moved it up to 25 because we did use more, but it has decreased so far. So if things stay consistent the rest of this calendar year, we'll be much closer to 500,000. And I do not anticipate coming back unless a lot of things happen in the last quarter.
But this is still an unknown.
It's an unknown.
Yes, just can't predict.
Yes. And jail reform has impacted that too. Jail reform happened about the same time. That was 2020. And what that means is people who used to get a lot of that treatment in the jail.
Yes.
And then didn't need the court hearing because they got medication, they were no longer on the substances, so they were able to represent themselves and be represented and understand their charges. Now they're out, never in sometimes. Okay, I'll say it for you, that's what happens. So that's a disadvantage, to be honest, in a weird sort of way.
We let them out on bail, so they're going to go back to substance abuse, so then they're not competent to stand trial.
You actually, I'm going to agree with you 100% on that statement. How's that? Yes. You nailed it, okay? Yeah.
So I just wanted to take the opportunity I always am on the side of how we can save or how we can, well, in that area that you have saved. So I just wanted to, thank you for the work that you have done to kind of help mitigate this and the work that you've done to inevitably help those individuals, but also get them out of somewhere where they really don't belong anyway. And, we can see that work right in our budget numbers too. So, thanks for that work that you've done.
The unique thing with the 730s is that we do get the request. So if you look at 730s and safety net, the expenses could be similar if it gets out of hand. The one control that we do have on the mental hygiene side is that we're receiving the individual referral. So now we can put it on our radar and we can track it from case to case to case. On the safety net side, you get so many applications on a daily basis. I believe we receive approximately 100 applications a day on average on that side. So it's a bigger number. So that's why this was, I don't want to say easier, but to track it and to be more on top of it.
But has your advocacy helped in this regard too, in the education of the judges?
I would say so. I would say the education, they're excited about having the court navigator, something they've wanted for a very long time. I'll be honest, I think that OMH has done a great job with collaborating with the courts and collaborating with the judges and providing education. And I'll be honest, I have a lot of counterparts that are DCSs that they love the word advocate, and they'll advocate till their faces are blue and all, and I just let them do it. And unfortunately, but fortunately, I get to benefit from the fruits of their advocation.
Any questions on this? Okay. Is that it for mental hygiene?
That's it, yes.
Okay. Thank you very much.
Thank you very much.
Thank you.
Thank you. Appreciate it.
Thank you.
Yes, thank you.
Okay, well, we will break now for lunch until 1 o'clock. Be here with bells on.
It's cool. It's cool. Thank you.
Is there a high-pitched noise just now?